Can we talk about a common sense approach to vaccines? They're really important to prevent infectious diseases in our dogs and cats, but they come with real risks. In the words of Dr. Ronald Schultz, Department Chair at the University of Wisconsin in Madison, be wise and immunize, but immunize wisely. I want to give you some ground rules here. First, I am not an anti-vaxxer. I'm a common sense vaxxer. Yes, I've even vaccinated myself. I've had vaccines for tetanus, for rabies, for yellow fever, even for COVID-19. Tula, she's been vaccinated for parvo, distemper, rabies. Murray had the FERCP vaccine, rabies vaccine. Murray, he was no longer vaccinated after it became part of our house. There's a few different studies and articles which I think will help you make a much more informed and better decision for your dogs and cats. There's an article in Innovative Veterinary Care titled A Study of Canine Vaccine Antibody Responses. In it, they reviewed canine parvovirus, canine distemper virus titer test results over a 15-year patient period. Titers are showing the level of protective antibodies, and they want to see just how long after a vaccine is your dog still protected. Distemper virus, parvovirus, these are two core vaccines for our dogs. They state that these are very high potent injections that significantly impact the immune health of our dogs, and they can have serious adverse effects, such as allergies, such as autoimmune disease in our dogs. As a measure of potency, canine parvovirus can have upwards of 10 million modified live viruses in each dose. 10 million. They took the dogs through multiple regimens and then subsequently would then test them for antibody levels, doing titer tests. They had different patients giving different regimens. So for instance, with one group, they were just given 2 boosters as puppies. Then every year they were doing follow-up titer tests. They wanted to see how long would they have protection after just those 2 puppy boosters. In that first group, it showed that nearly 80% of the dogs, they had adequate protective titer levels after 5 years. So 5 years, they're just given 2 doses as puppies. 5 years later, they're still protected. Meaning they weren't given 3 doses as puppies, they weren't given a full booster in a year, they weren't given vaccines then again every 3 years. 2 boosters as puppies, 5 years later, fully protected. Another point I want to make for our dogs is think about the volume of vaccine. How is it that we're vaccinating a little 3-pound toy dog with the same 1 cc and 10 million virus particle vaccine as we are giving to a 150-pound big, large Great Dane? Obviously, it's not the volume of the vaccine, it's a number of virus particles that are then there to stimulate an adequate immune response. So that would be like you and I, aka a 150-pound person, getting the same amount of virus particles as you would say to a mid-sized elephant, like some animal that is 50 times your size. Does that make any sense? So if you were to be given the same amount of vaccine as you would be given to a 7,000-pound elephant, chances are you're gonna have a vaccine reaction. And I really think you can equate the similar thing to a little 3-pound toy dog and the 150-pound dog. The article on Innovative Veterinary Care then makes a couple different key recommendations. So first, they're suggesting vaccines 2 doses as puppies, i.e. 12 weeks, 16 weeks. Then a year later, do a titer test. See if they have protective level of antibodies. And if more than 1 vaccine is needed at a time, i.e. distemper, parvo, and rabies, separate those by upwards of 4 weeks. And by doing that, you can minimize adverse vaccine reactions. And then with our cats, maybe even more disconcerting, we're manufacturing the primary core vaccine, FERCP, so feline viral rhinotracheitis, calicivirus, panleukopenia. We're growing it on feline kidney cell cultures. That's right, we're using cat kidney cells to grow a modified live virus vaccines. So if you give your cat a cat vaccine that's grown from cat kidney cells, guess what? You produce autoantibodies. Antibodies to your cat's own self. For me, the most common disease that I would diagnose in our moderately older cats is CKD, or chronic kidney disease. So now many researchers, they now believe that the epidemic of CKD, chronic kidney disease, in their senior cat population, it's directly related to this: repetitive doses of these cat vaccines that are grown on feline kidney cell cultures. There's a number of different studies now showing the prevalence of autoantibodies in cats that are vaccinated with these vaccines grown on feline kidney cell cultures. And then you can think of some of the other inflammatory diseases of cats. Inflammatory bowel disease, diabetes, liver disease, pancreatitis. All of those can potentially be linked to these cat vaccines. Obviously, I didn't want my cat Murray to get any serious respiratory diseases. Did not want him to develop panleukopenia, that's feline distemper. But you're gonna be hard pressed to find a veterinarian that's gonna say, I just see so many cases of feline distemper. I've yet to see a cat with CKD. So when I do get a new cat, which hopefully be in the very near future, he or she is on to get vaccinated with vaccines produced on feline kidney cell culture. But I would still do the core vaccines. I would do FERCP, I would do boosters at 8 weeks and 12 weeks, and once again do titer testing in a year. So I still think it's really important that you continue to use vaccines as a preventive tool for infectious disease. But do it wisely, be aware of the risks, and do it in the correct way so number one, we're protecting our dogs and cats, we're not making them sick. That's my approach to common sense vaccines for our dogs and cats. I'll put in links in the description box to all those studies, those articles that I've referenced. And just thanks again for watching this video. Click up there to subscribe, hit the bell to sign up for notifications, then when you click that link directly in the box below, I can send you a copy of my free book.